Hold your applause. Thank you, John. Thank you very much for pulling us all together. We really appreciate year in, year out. Political Fellows really is an outstanding group and has done so much just in the years since I've represented Sam. You know, just helping us in a number of our initiatives, including how we ought to reform healthcare, town hall meetings where we're listening, trying to gather feedback, town halls we've done here on the university campus, and just involvement in everything from our veterans to every key, I think, effort in our community, and you all are there. So thank you very much. And I've been blessed. I've got so many interns and staff from fellows. Justin Milan, who's our current field representative, political fellow Cameron, Carly, who else has been intern? We got a bunch, thank you. All have done a great job for me, so thank you very much. I'll be real brief because I want to hear your thoughts, your questions, issues we need to have on our radar. Obviously, big election coming up Tuesday. That's going to determine a lot of what happens here, not just next year, but in the lame duck session. Congress will meet between the election and when the new Congress takes over. So what happens on Tuesday is going to affect that a great deal. But I wanted to, in just about 9 minutes, go through a couple things sort of on people's radar these days. The economy, where it's headed, some of the barriers for us getting back on our feet, spending, and especially how that's going to affect those of us and you who have to pay all this debt back. And then the healthcare, I wanted to give you a peek what the new healthcare law of the land looks like. On the economy, you know, America is unique around the country, around the world. No country bounces back from tough economic times as quickly as the United States of America. I think you and I are just genetically predisposed as Americans to get back on our feet quickly. And usually the more severe the recession is, the quicker we bounce back. But not this time. This is one of the slowest recoveries on record. It's 3 times slower than 1981 to 82. In fact, since the beginning of the year, we started to pull out over the holidays. And since January, we've lost 2/3 of our economic momentum. Consumer confidence, which drives so much of our economy, people getting back in the stores, willing to spend money, big part of our economy. Our consumer confidence level is back where it was 18 months ago. Before even the stimulus began, it's lower than that. That's holding back our recovery. I'm convinced part of that is the job situation. Part of it is housing value. So much of people's wealth is tied up in their home. But the other part of it is listening to families in our communities. People really take a look at all the debt and deficit that the American government's running up, and it frightens them. They know it can't be healthy for us as a country. They wonder who's going to have to pay all that back. So that's, I think, holding back consumers from coming into our stores. The other thing is businesses, job creators, small businesses, mid-sized businesses, large, are holding on to, they're not confident either. They're holding on to almost $2 trillion of capital. That normally, at this point in the recovery, they ought to be hiring back workers they laid off, hiring new workers, buying that new piece of equipment, or making that expansion plan that they've been waiting to do. That's what they ought to be doing. They're not at all. In fact, just the opposite. Most businesses tell us, and I wear a new hat the last couple of years as the top House Republican on the Joint Economic Committee. So we study the economic data both here in the U.S. and globally, daily basis. But businesses tell us that they're reluctant to use that money for the recovery because of what's coming out of Washington. They hear a lot of talk about higher taxes, about new regulations. They realize the new healthcare law is going to cost them more to cover many of their workers. They hear about new energy taxes, and so what they tell me is it's tough enough to predict the market and what we should be doing in the free market, but trying to predict the free market in Congress is impossible. So we're just going to hold on to our cash. I'm convinced that until Washington sort of gets out of the way, lets consumers and businesses bounce back, we aren't going to see the recovery that you and I want to see. So from your standpoint, clearly we've got to this year and next year restore that confidence so that those of you graduating, looking for that first really key job in the marketplace, that we have them available to you. But right now, the reason we have to do that, if we don't get this economy restored, we won't get back to where we were for most of this decade. We will literally be at 9%, 8%, 7% unemployment for 5, 6, 7 years. That's not good for people coming into the marketplace. So we've got to get this economy going for your sake and for the country. Spending, I referenced that, but we really are spending in amounts I've never in my life dreamed we would do. America has the third largest deficit on the globe, in the world. Did last year, do this year, may well next year. We've added, as a nation, almost $5 trillion of new debt over the past 3.5 years. It is so much, it's hard actually to fathom it, except to say that 3.5 years ago, the average debt that everyone owed of their government was $29,000 a person. And in 3 years, it's now nearly $40,000. Put it another way, just paying back the stimulus and the bills that have been put in place this past year and a half for a person graduating from college today at age 22 and getting a job, your part of that debt is the equivalent of a second car payment that you'll come out of your paycheck over your lifetime to pay back debt. So what's happening in Washington today has a huge Edward impact on you, you know what I mean, especially in your paycheck, how much you get to use for yourself and how much the government takes to pay all this back. And if we don't change the spending pattern, we could be $20 trillion in debt by the end of this decade. Again, it's such a large number, it's almost hard to imagine. But I always remind people that $1 trillion, to put it in perspective, Simon, if you and I started a business the day our Lord was born and lost $1 million each and every day, we still wouldn't be at our first $1 trillion in losses. We're racking that up every year in deficits. So, and for the country, what it means is, every economist tells us when you get to that type of debt level, it drags your economy down. It's just like in your family, if you rack up lots of debt, your mortgage payment gets bigger, you have so much credit card debt, it's taking so much of your paycheck, it slows you down as a family and as a business. Same thing as a country. The more debt you have, the bigger burden it becomes. Your money goes to paying that off. It doesn't go to productive things, good things. So that's a concern, again, for young people. Getting the spending under control is just critical for you, so you aren't dragging that debt around the rest of your life. It's supposed to work, and this is the result of it. Everything in color in this chart is newly expanded or added by the bill, except for this. The Secretary of Health and Human Services, the reason they're at the center of all this is that that's sort of the new healthcare czar. That's the person who directs so much of how healthcare is delivered in America, what plans are offered, who can offer them, what the price is going to be, what providers, what doctors, hospitals, and others can be part of it. So this person, this one person under the bill has 600 new authorities, new powers under this bill than they did before. And in this 2,800-page bill, that one person is referenced 2,200 times. So they're going to have a huge impact on our lives. Everything in blue, all those blue dots and circles right there are, and by the way, we have this on our website, and we can get you copies, full copies of it as well, if you want to look at it more carefully. Everything in dark blue is expanded government in healthcare. Everything in the orange, in the Bearcat orange, is are organizations that ultimately will have the power to ration care. Not immediately, but when the government starts to run out of money to pay for all this, and it will, they'll be making decisions on what treatments will be offered, how the government will reimburse doctors and hospitals and home health care agencies, and long-term for you, especially if you are in this system, over time they will have increased power over what kind of care you'll get. Everything in green in this chart is either new tax increases or new cuts to Medicare. Medicare, if you remember, is a health care plan for our seniors versus Social Security, which is a retirement plan for our seniors and Medicare that a lot of our grandparents are on, for example. $500 billion in cuts to Medicare, $500 billion in new tax increases. The new tax increases are on everything from health insurance plans to medical device like oxygen, bed pans, and hospital beds, to new surcharges on Medicare, new taxes on tanning beds, not a big deal, but new tax on investment income. So many new taxes that the IRS up here, we estimate, will have to hire up to 16,000 new agents just to force compliance and to keep up with all the new taxes in this bill. The other part of that are cuts to Medicare, our senior health care plan. The bulk of it is to the Medicare Advantage plan. That doesn't ring a bell, but it's the most popular plan in America. Set of plans, most popular plans in Texas. And the reason it's popular is that for our elderly, Medicare Advantage combines their prescription pills, their doctor visits, their hospital visits, and the preventative care all in one package. So they get it very conveniently. It's important in rural areas that doesn't have a lot of choices. It's the #1 plan for minorities because, again, it puts it all in one package so seniors have more convenience. That takes a huge cut in this bill. The Medicare and Medicaid services, the national, federal group that does it, estimates that up to half of Texas seniors will be either forced out of their Medicare Advantage plan or pay up to $900 more a year to keep it because the new government plan doesn't like Medicare Advantage for a reason I think is poor. Other cuts to home health care, hospice care, skilled nursing, all that. And none of those cuts go to make Medicare better, they go to pay for this. The yellow things are new mandates on businesses that offer health care. The light blue is government expansion into the free market as opposed to just government expansion into the free market and healthcare system. And of all this chart, if people ask what's the one box or circle or triangle that concerns you the most, the answer for me is right here, the essential health benefits package. Here's why. The whole premise of this law is that everyone in America has to have government-approved health care or pay a tax. And most businesses, not all, most businesses have to offer government-approved health care or pay a tax. That's the premise of this whole new law. But this box and this person will decide what government-approved means. What it does so far, what we know it means is that about 70%, 3 out of every 4 workers who get their health care at work, like here at the university or the city of Huntsville or a business down the street, won't be able to keep the plan the way they have it today. They'll be forced to make changes to it. The costs are going to go up because of all the new mandates, 17 new mandates. A lot of them are very popular mandates, but all of them drive up the cost of health care. But this essential health benefits package, determined by this person, with the advice of all these bureaucracies, really will determine no plan in America will be offered without that seal of government approval, how much it costs, how much you can pay, what healthcare providers, what doctors and hospitals can be part of it, all comes out of the government. Major change from the way we operate today. Couple final points. We actually, between the physicians and patients, there's 159 new government agencies, bureaucracies, and commission involved in between you and your doctor in healthcare. We actually couldn't fit all of it on this chart. This is only 1/3 of the total bureaucracy. In fact, if you go to if this were a computer screen, it is, but if it were really working and you punch these tricolored modules there, we call these bundles of bureaucracy. If you pop that on, you'd see 22 new government agencies that didn't fit on this chart, 59 new federal grant programs, 19 special interest provisions that were put in there to try to pass the bill. And all these lines sort of dominate this. The black lines are the new reporting requirements, red lines more reporting, green new money flows, yellow new oversight. But if you pulled this up on our computer, went to our website, and looked closely, we were so meticulous in detailing this. Embedded in every line in here, in tiny numbers, is exact provision of the bill that creates some of this. We wanted to make sure we had gone down to the very, so this was so accurate and people could rely on it. That's, I don't know what your impression is of that chart, but for most people it's bewildering. And for most, it isn't really the healthcare reform many of our families in East Texas and this area were looking for. There's no question. I commend the president. He was absolutely right to tackle healthcare reform. We needed to make changes. The question is this what we were hoping for in healthcare? Will this lower costs? Will it make it higher quality care? Will we have more say in our own healthcare choices? And that's sort of the gist of it. So, Professor John, your permission, can I stop and just take some questions or comments on any of this or any other issue I need to be working on?
Some of you may have questions about his job, the duties of a congressman, or what means to him on a day-to-day basis. So anybody who has a question, feel free to fire away.
And I just need easy questions too, by the way. Did I mention my wife, Cat D, is a Bearcat? Right. Does that help? Yes, sir.
I actually just thought of one while you were explaining that, and from what you're saying, the new healthcare plan is not actually establishing new government-ran healthcare. It's the government telling what healthcare has to have in order to qualify to be used. How will that affect small clinics that cater to people that can't afford a healthcare plan? Because I know for the last 2 years I couldn't afford a healthcare plan, so I had to go to small clinics.
Yeah, don't know yet. The way they cover, government will control much of the healthcare sector. But the way they cover new people, half of them will go into Medicaid, which is another government program for those low income. Others will be funneled into the exchanges. Those community clinics, and we have a number of them around our area, it remains to be seen what their use is going to be. Yeah, we don't know yet. We don't know. We do know we've already run into some problems because the way this is structured and government approved. You know, we already have colleges that are struggling because, you know, colleges like Sam offers a healthcare plan, pretty low cost. It's because most of you are very healthy. But under the new law, government approved means they have to provide a big package and has to cover you until age 26. Well, colleges can't afford to do that, so they've asked for a waiver. We've had child-only plans that aren't offered anymore because they don't meet the criteria the government approved. And then you've read about McDonald's and others that have mini-med plans. They're pretty low cost. They sort of cover the first $2,000 of healthcare costs for workers in, you know, those service industries. It costs about $14 a month, so it works out. But that wasn't covered under this either. They got a waiver as well. I think as all these regulations get written, you know what I mean, as the plan gets fleshed out with all these new rules, you know, we're going to see then what the impact's going to be. I'm sorry I don't have an answer, but so much of this will be rolling out over the next 2 to 3 years. Those clinics, by the way, do a great job in our area.
I had one that I went to in Waco that was just amazing. It was cheap and real doctor and everything.
Yeah, makes a difference. Just me.
Well, do you think then the insurance providers will some of them just get out of the market altogether? In other words, like my husband's fully employed, but they don't offer health insurance, so they will, I assume, at some point have to offer it. So the people that he's insured with now, are they just going to say, oh, well, we'll just get out of Texas altogether, so he won't really have a choice whether he has company insurance or whether he wants to continue with the private insurance he has?
I think 2 things are going to happen. One is insurance companies are going to consolidate. The bigger ones are going to get bigger. The smaller ones are going to go away in insurance. So I think we'll have fewer choices there. Businesses have to make a decision on how they're gonna meet the new mandates. And the government says, and here's where I think they got the incentives wrong in this bill, in my view. For example, every business, most businesses have to offer government-approved plan or pay a tax. But here's how it works. If your company offers a healthcare plan today to you, but it's not government-approved, that company has to pay up to $3,000 per worker. But if they don't offer, if the company doesn't offer a plan at all, they only have to pay a fine of $2,000 a worker. Think about that. The company's trying to do the right thing and offer health care, but it's not government approved, doesn't meet the new standards. They pay more than if they just drop coverage and pay the $2,000, let you go into the exchange. So our worry is businesses are already running the numbers to figure out, okay, what's more affordable for us? To keep providing health care to our workers as we've always had and pay more, or drop it and pay the fine, which comes out to about $183, $187 a month. Our worry is businesses will choose the second one. Most companies offer health care because they want to keep the best workers. They want a workforce that will stick with them, be knowledgeable, they want to attract the best and brightest. And that's why they offer it. But if other companies are dropping those plans, then my worry is that there'll be a stampede toward a lot of companies dropping it. And so I think from that standpoint, the incentives were sort of the opposite of what it should have been. So the answer to your question is, it depends. You know, what that business, after this is fully in place, and they have to meet that mandate, depending on the size and the salaries of their employees, what that average salary is and what that size is, they're gonna have to make some decisions. What worries me, I met with a healthcare provider, big system, down at Texas Medical Center, walking through, you know, they were telling me their concerns about this, and they ran the numbers too. They're really big. Each year, they right now spend $120 million a year insuring their workers, but they ran the numbers, and if they just drop health care and pay the fine, it's about $25 million a year. Now, they're not going to drop it. They're a healthcare provider, but their point was, if we ran those numbers and saw that difference, other companies are running those numbers, and our worry is that they may well drop it. So I think we'll see that over the next 3 to 4, if this is kept in place over the next 3 to 4 years, I think businesses will make that decision. Right now, they're already, because there's a tax on certain types of healthcare plans that are seen as too wealthy, they're already starting to adjust their plans right now this year to try to stay under that. I'm sorry the answer was a long answer to a short question, but so much depends. Yes, ma'am.
Okay, how, this new healthcare bill, how are you, as the government as a whole, going to distinguish who qualifies for the government-assisted medical finances? And are you going to better distinguish the people that actually need assistance and the people that aren't willing to work for it?
Yeah. The answer is most of it will be determined by income level. You know, as I said, half of those that will be covered, new people covered under this, will be served under Medicaid, which is our healthcare or our system, healthcare system for very low income.